It's the most common cancer in women. According to breastcancer.org, every 2 minutes a woman in the United States will learn she has breast cancer. But while more cases are being diagnosed, more women are surviving. Despite that, breast cancer continues to be the disease that many women fear the most.
It was terrifying. It was something I didn't expect.
I was healthy, I was athletic, I had a good diet. I did everything I was supposed to do, and here I was diagnosed with this very aggressive form of cancer.
In the past, breast cancer was shrouded in secrecy and fear. Treatments were often limited to disfiguring surgery and harsh chemotherapy. And even then, nearly 2/3 of women died within a few years of their diagnosis. Today, while the breast cancer experience is certainly not easy, treatments are less harsh and more effective. But before we examine treatment, take a look at how breast cancer starts. Dr. Gabriel Hortobagi is the professor and chairman of the Department of Breast Medical Oncology at the University of Texas MD Anderson Cancer Center in Houston, Texas.
Every breast cancer starts with the development of a genetic abnormality. A gene or several genes are altered by either hereditary or environmental influences.
As with any part of the body, the cells in the breasts usually grow and then rest in cycles. But breast tissue cells can develop a genetic change that results in an uncontrolled and abnormal growth of cells. This is breast cancer, an uncontrolled growth of cells that can stay within the breasts or spread to the lymph nodes or distant sites throughout the body. When a woman hears she has breast cancer, she may wonder if she did something wrong, something that caused her to have cancer. But in fact, the exact cause of breast cancer is unknown.
Anyone in your family?
Women at highest risk include those who are older age, over 60, have already had cancer in one breast, have the BRCA1 or BRCA2 gene mutation or another gene that increases the risk of developing breast cancer, have a strong family history, a mother, sister, or aunt with breast cancer, or 2 or more close relatives with breast cancer or ovarian cancer, have a premalignant change in the breast. The female hormone estrogen has a powerful influence on breast tissue. In fact, the more breast tissue experiences menstrual cycles, the greater the likelihood of developing cancer. Women with a few cycles, late onset of menstruation, multiple pregnancies with a 9-month hiatus of menstrual cycles are at lesser risk, whereas women who never had a full-term pregnancy or were 30 years old or older when their first child was born, plus women who began their menstrual cycles before age 12 or started menopause after age 55 are at higher risk. More than a decade ago, 62-year-old Houston attorney and federal law clerk Nancy Berg Benjamin noticed a lump in her breast. She wasn't prepared for the answers that her doctors would eventually give her.
I think anybody, when you receive a diagnosis of breast cancer or cancer, any kind of cancer, is devastated. It's a very frightening experience.
After she recovered from the shock, she went on to reorder her priorities.
I found that I wanted to spend more time with my family and my friends, doing things for my community, making a difference in this world, because you may not be here tomorrow.
It's not that Nancy was unfamiliar with cancer. Her physician husband, Robert, is a cancer specialist.
I too was stunned by the diagnosis, but having dealt with cancer in my mother and dealing with cancer in my patients all the time, I tried to help support her in every way I could during the treatment.
Finding breast cancer early offers the best chance for a successful outcome.
Just stand right in front of the machine for me.
There are 3 ways breast cancer is usually detected: mammography, breast self-exam, and the physical examination of the breasts by a health professional.
Adjust this just a little bit. I want you to come towards me.
Mammography is a type of X-ray that assists in finding a lump or a mass. Mammograms show nodules, calcifications, thickenings, and distortions. In the vast majority of cases, these findings are not cancer. They are benign growths, cysts, or something else harmless. Recommendations for early breast cancer detection include: breast self-examination is an option for women beginning in their 20s. Women in their 20s and 30s should have a clinical breast exam as part of a regular health exam by a healthcare professional at least every 3 years and throughout life. Women age 40 and older should speak with their health professionals about when to have a screening mammogram. Doctors say women over age 50 should have a mammogram every year, and some women in high-risk categories should discuss possible early mammography with their doctors. Breast self-exams and the physical examination of the breast by a health professional can help locate a mass, but mammograms and other imaging techniques are generally necessary to find the smallest tumors. The diagnosis must be confirmed by a biopsy, and if the specimen is malignant, the breast cancer journey begins. Coming up, we'll meet a woman who traveled the world competing in racing events. The only thing that slowed her down was breast cancer.